Welcome to the part 3 of the Pain Truth video. Before we begin, I make an assumption that you've already completed the 10 danger and 10 safety questions from the part 2 video. So far, you've learned that all pain is real and that although you may feel the actual pain in your back, neck, shoulders, or knees, all pain is only perceived in the brain. You've also learned that pain can sometimes persist and be severe even when there's no serious injury or damage to the body. This happens because the spinal cord and the brain can magnify pain. This is referred to as nervous system hypersensitivity. Basically, when you feel pain for a long time, the nervous system and the brain physically change and become really good at feeling pain. Just like if you did any activity for several hours a day every day, you would inevitably get really good at doing the activity, whether it's playing the violin or playing basketball, or in this case, feeling pain. We also learned that the brain is continuously monitoring for any dangers. If the brain judges that we're safe overall, both physically and emotionally, it releases pain-relieving chemicals such as morphine and serotonin, which keep us calm and relaxed. You now know about DIMS, which stands for dangers in me, and SIMS, which stands for safety in me. If the brain judges that we're in danger overall, both physically and emotionally, it stops releasing the pain-relieving chemicals and may release adrenaline. This can actually increase sensations of pain. To reduce nervous system hypersensitivity, you basically need to do two things. First, increase the number and the intensity of things your brain perceives as being safe. Secondly, reduce the number and the intensity of things your brain sees as being dangerous. Regretfully, the brain of a person who falls into the persistent pain cycle gets really good at focusing on potential things that are dangerous and stressful, and stops focusing on all the things that are still safe and good in their life. At times of acute danger, the brain should focus on the potential danger for survival, as priority is to remove the hand from the stovetop. However, if long after the initial acute injury, the pain still persists and becomes chronic, not only is focusing on pain not beneficial, it's potentially harmful. Once again, I'm assuming that you've already seen a physician and that serious medical conditions have been ruled out. However, if your doctor has sent you for an X-ray or an MRI, there's a good chance you've been told of all the abnormalities they found. Naturally, your brain will perceive your arthritis or disc bulges as dangerous and will focus on the dangers and cause you unnecessary stress, when the truth is that for the vast majority of cases, radiological findings are irrelevant. Our thoughts and stresses can be like heavy rocks that we carry on our backs, necks, and shoulders. So stop carrying a heavy rock on your back, especially when it's exhausting you and not serving you. What if you intentionally, with your thoughts, focused on making the rock smaller? Or even better, put the rock down. It's your thought. You can do whatever you want. Here's an excellent quote dating back to 1890 from Dr. William James. The greatest weapon against stress is our ability to choose one thought over another. You can instantly lessen your persistent focus on life stresses by making a conscious effort to shift your attention to what is still enjoyable, safe, and good in your life. This is certainly not an easy task, especially when one is in pain, but it's definitely possible. You can instantly lessen your thoughts about your past stresses and lessen your worries about your future by shifting your focus to the present. Here's a popular quote: "Those who live in the past can experience depression. Those who live in the future can experience anxiety. And those who are in the present experience peace of mind." As you'll see, I strongly recommend practicing mindfulness to all my patients who realize that stress and fear are contributing factors to their pain. With practice, the brain can change based on how we use it and choose to think. Your brain will reduce the weight of the rock you're now carrying once it realizes that it's safe to put it down. So how can you make your brain feel safe? Here are 10 actions you can take to help your brain feel safe and in time reduce your nervous system hypersensitivity and improve the quality of your life. Action number 1. Understand the truth about pain. Understand and fully appreciate that although your pain may be severe, it doesn't necessarily mean that you have a severe injury. Studies show that those who truly understand that their brain is a contributing factor to their pain recover much better than those who continue to believe that the problem lies only in the specific part of their body. There have been cases where the brain calms down immediately in those who receive pain education and understand the concept of nervous system hypersensitivity. To learn more, please read the Pain Truth book or any other excellent books referenced at the end of this video. Action number 2. Breathe and be mindful. Put 1 hour a day aside for relaxation, focused breathing, or mindfulness meditation. There's so many studies to support those who do daily mindfulness meditation have significant reduction in their pain and a reduced need for pain medications. This is as easy as joining a yoga class or typing mindfulness meditation on YouTube. You may specifically look into Jon Kabat-Zinn. Action number 3. Drink water. I don't know exactly how many cups, but a few cups of plain water. Limit your caffeinated drinks, sugary drinks, and juices. You can surely appreciate highly sugary and caffeinated drinks stimulate nerves and can increase nervous system hypersensitivity that you're trying to decrease. Action number 4. Eat food. By food, I mean anything that looks like real, actual food, and that's not out of a box, a package, or out of a drive-through window. It's simple. Have 2 servings of fruit and 2 servings of fresh vegetables every day. Or consider seeing a registered dietitian. I know it's a cliche, but what you eat does affect how you feel. So do your best to eat well for your pain. Action number 5. Start moving. You must devote at least 1 hour each and every day to consciously move. This doesn't mean you have to do the 1 hour all at once. You could break it up into 4 15-minute sessions or 6 10-minute sessions in a day. The movement can be walking in the park, tai chi, yoga, aqua fitness, lifting dumbbells, whatever works for you. A physical therapist can help you set realistic physical goals and help prescribe the ideal physical activity for you. Action number 6. Sleep well. Try every trick in the Pain Truth book to help you sleep better. Things as simple as going to bed at the same time every night and avoiding computer or phone screens before bedtime. Speak to your doctor about your sleep issues. Perhaps go to a sleep clinic. Prescribed medications should be the last resort. Action number 7. Spend time outside. Did you know that humans now are the only true generations of cavemen? At no time in the history of mankind have we ever spent more time indoors than we do now. The human body was meant to be outside, not locked up day and night in a room or an office. We need to see light. We need to see and feel the sun. If plants had our lives, most of them would surely wilt away. Have your doctor check your vitamin D levels. You may benefit from supplements, but that still doesn't replace going for a walk or sitting outside for 1 hour. Action number 8. Write down your DIMs, stresses, and emotions. Certainly stress can increase pain, but did you know that buried or suppressed emotions may be the reason your pain is not getting better? Sit down and write a list of all the emotional issues you can think of. For example, anger, hurt, shame, fear, guilt, or whatever. Don't underestimate the power of writing therapy. There's no right or wrong way of writing out your feelings. Just write whatever you feel. There's no need to fix anything either. It's only important that you become aware of your emotions. If there are issues in your life that make you feel angry or guilty for feeling angry, write them down. No longer hide them. There's no need to share your writings with anyone. You have the option of tearing the paper and throwing it out. Do this for 15 minutes every day. You may be surprised how good writing therapy feels and how it can reduce your pain. If your current job is a major source of stress, then make a plan of doing something. Staying at a stressful job because you feel like you have no other options can be emotionally draining. You can't just keep ignoring the stress. Your health depends on it. Action number 9. Write down your Sims and do fun things. Write a list of everything that you've ever enjoyed doing or have considered fun. These could be activities you did when you were a child or many years ago. Do something fun for at least an hour every day. It doesn't have to be expensive, exotic, or physical. Make a point of listening to music or an old record that you once enjoyed. Draw, paint, go dancing, join a walking group, go to a movie with a friend, play an instrument, meet an old friend for lunch, but talk about anything but your pain. Sing in the shower, smile for no reason. Although hard to believe, just keeping a constant fake smile can make a person feel better and reduce pain. Try it for 1 whole minute. Then try a fake laugh for 15 seconds. Like, you gotta try it. Endorphins are very powerful painkillers without any side effects. Lastly, focus on bringing joy to someone else. Compliment others. Hold the door open for the person behind you. Hug someone. Volunteer in a hospital for seniors' home. It's really the single best way of focusing away from your DIMS, problems, and stresses. It is guaranteed to make you feel better. Action number 10. Write down a plan. The brain is amazing. It will not do anything unless it has a purpose. If it has a clear purpose and a goal, it will do everything to achieve it. Grab a piece of paper now and write down what you would really like to be able to do in 3 months, 1 year, and 5 years from now. Sorry, being pain-free cannot be a goal. Without clear and exciting goals, your brain will find it hard to get motivated to do anything, including just getting out of bed. Go ahead, write down on a piece of paper all the things that you would like to achieve and look forward to achieving in your career, physical health, and socially. Then break the goals down to smaller bits with a timeline to do them. This is a key factor in your recovery. In summary, considering how complex persistent pain is, are you surprised that the treatment options outlined here have been relatively uncomplicated? Did you notice that none of the options for making you feel better involved purchasing anything? No lotions and no fancy gadgets? Please, don't get misled by the relative simplicity of the advice given in this video. The information is based on hundreds of books and medical studies. In my 25 years of experience as a physical therapist, having seen thousands of patients, I've noticed that when my patients' life stress levels decrease, most often their pain levels also decrease, and sometimes their pain even disappears. However, when stress levels, lack of physical activity, poor diet, and lack of life enjoyment persist, pain rarely changes. Let's do an experiment. Grab a small object, anything like a water bottle or your cell phone. Now pretend whatever you're holding is a small rock that you're carrying in your hand. How heavy is this small rock? Certainly less than 1 pound. The weight of the rock doesn't matter. It depends on how long you hold it for. If you hold it for a few minutes, it's not a problem. If you hold it for a few hours, you'll have an ache in your arm. If you hold it for days, weeks, or months, your arm will feel numb and paralyzed. In each case, the weight of the rock doesn't change, but the longer you hold it, the heavier it becomes. The stresses and worries in life and over your pain are like that small rock. Think about them for a while and nothing happens. Think about them a little longer, they begin to hurt. And if you think about them all day long for weeks on end, you'll feel paralyzed and incapable of doing anything. I strongly recommend that you put your big or small rock down and stop carrying it around everywhere with you. It's time that you change your thinking about your pain and chose a different strategy. Instead of only relying on doctors, therapists, or medications, realize that you have the power to change. Stop striving to end your pain. Stop the constant focus on fighting your pain, but accept the pain for now. Acceptance doesn't mean that you're giving up. In fact, it means the opposite. Acceptance means that you'll no longer allow it to rule you and take over every aspect of your life. Acceptance means that you're putting down the rock and will not allow this temporary pain condition to stop you from once again enjoying life. I have no timeline for you, so I can't possibly tell you how long it will take for your pain to improve. I make one promise though, and that is that once you follow the 10 recommendations I've outlined, and once you put down the rock, the quality of your life will improve despite the pain. You, your family and friends, and all those around you will see the new you when you follow the 10 actions I have recommended. I urge you to watch the Pain Truth video series a few more times and read other pain education books such as Explain Pain, written by Lorimer Moseley and David Butler, two world-renowned Australian physiotherapists and pain educators. Painful Yarns, also written by Lorimer Moseley. Why Do I Hurt? Written by Adrian Lowe, an American physical therapist. Understand Pain, Live Well Again, written by Neil Pearson, a Canadian physiotherapist. The Pain Truth and Nothing But, written by me. This is Baram Jam, and I wish you a safe journey in your well-being. Now that you've viewed the 3 Pain Truth videos, please refer to the end of the Pain Truth workbook. As part of the 6-week pain intervention program, you're required to complete the weekly calendar on a daily basis. Your daily active participation is absolutely essential for your recovery. It's one thing to just learn about the 10 interventions for managing pain. It's another thing to apply the 10 concepts into your daily life. If you have any questions, please ask your healthcare provider. They will be happy to help you achieve the health goals that you've set. It's strongly suggested that you view the 3 Pain Truth videos and read the workbook once a week for 6 weeks in order to have the material programmed into your brain. I wish you a safe journey in your well-being.